Can you see Sandra di stop or yeah.
Hi everyone, are you guys excited? You are in your final seminar before graduation. Woohoo! I am so proud of you guys. My name is Dr. Sandra Garcon, and I'm here today to do a review with you guys on motivational interviewing. And I know all of you guys have gotten Dr. Miller's book, Motivational Interviewing, and read it, correct?
Yeah.
Mm-hmm. Right, awesome. So you guys are prepared and ready. So what I hope to do is to give you guys a review on motivational interviewing, and hopefully that will be the foundation on how you begin your practice as therapists. So today we're going to be going over 3 learning outcomes that I hope this video is able to give to you guys. The first one is analyzing understanding of the process and spirit of MI through role play and peer evaluation. The second outcome is to evaluate how the use or lack of proper use of the spirit of MI affects the outcome of MI as an effective modality for clients struggling through ambivalences to change. And the third outcome is to incorporate Aura's skills in motivational interviewing as foundation in developing your own counseling styles. So let's start with a video.
My name is Clark. My name is Alan Online. Dr. Seal asked me to talk to you about your drinking.
Oh, okay.
And he said that you filled out the form and that you came to him for some medication for your stress, but that he was really concerned about your alcohol consumption before he made any prescriptions for you. So let me see that form, please.
Okay.
Thanks. Yeah, well, it says here that you drink 4 more times a week, and that you have 1 or 2 drinks, and that you go over that limit on a fairly regular basis. That's too much. Too much. I mean, I imagine that he's already told you that he can't prescribe you anything unless you do something about this drinking.
Okay, I'm really confused. He did want me to come and talk to you. I'm just not real thrilled with the way this is going.
Well, I'm sure you're not, because anybody that drinks at these levels isn't going to be thrilled talking about the drinking with a professional like myself. What we know is that if you continue to drink at this rate, you're probably going to wind up drinking more and more, and I imagine that's his concern is you're
I
not
didn't
doing
think I was drinking that much. I mean,
Well,
1 or 2 glasses of
Well,
wine
how
a
big is the
night.
glass? I mean, this is a typical glass, which is 5 ounces of wine. But what I know is that most people drink a lot more than that. So
Well,
I'm pretty sure that your glass is bigger than that. What would you say?
you're not in my household. You don't know what I drink.
Yeah, I know,
It's about that size, maybe a little
I've never
more.
been in a house where they have these thin glasses. That's only at restaurants. Most people have tumblers, so I imagine that's why I find if I open your cupboards.
No.
Well, anyway, so what he said was that you came to him for some kind of benzodiazepine, something for anxiety, and we can't prescribe anything like that if you're drinking at these levels. So we need you to stop, or at least cut back to reasonable levels, which for you would be no more than 3 drinks in one setting, which you're drinking over that now, or no more than 7 drinks in 1 week, which you're well over right now. So if you can agree to that, and then perhaps he can make that prescription for you. I can't promise that either, but that's certainly one thing. The other thing you need to do is to read this, take this pamphlet and read it, and you'll see in there that it tells you about limits of alcohol. I think you'll find that if you can stick to that, you should be okay. You may be able to prescribe the medication. I'm not sure, I can't promise. But if you do have problems, and I suspect you may have problems coming back to those levels, then we can make a referral for you to counselors to come and talk about your increased drinking. Any questions for me?
No questions at all.
All right, well, thanks, and I'll tell Dr. Seal that you came in and that you were reasonably compliant, and you said you followed through.
You tell whatever you want.
So what are your thoughts on this video?
He was not very compassionate as a clinician, and it seemed as though he was being very judgmental of her condition and what she was going through. It made her feel like a criminal.
Insightful. Any strength that you guys saw in this video?
He addressed the problem, but in a wrong way.
Okay. So is this the kind of therapist that you guys want to become?
No.
I imagine not. So let's talk about motivational interviewing to give you guys a much better method of engaging clients. So let's start with the definition of motivational interviewing. Can I have a reader to read the first one for me? Joanne?
All right. Motivational interviewing is a collaborative conversation style for strengthening a person's own motivation and commitment to change.
Okay. So what about the practitioner's definition? A reader? Fabiola?
Motivational interviewing is a person-centered counseling style for addressing the common problems of ambivalence about change.
Mm-hmm. And what about the technical definition? Jennifer?
So, motivational interviewing is a collaborative, goal-oriented style of communication with particular attention to the language of change. It is designed to strengthen personal motivation for the commitment to a specific goal by eliciting and exploring the person's own reasons for change within an atmosphere of acceptance and compassion.
Okay. So you've gotten these three definitions. Just from these and what you know about motivational interviewing, what is your definition of motivational interviewing? Shirley?
Motivational interviewing is a respectable way of partnering with clients to address their ambivalence towards change in order to help facilitate positive change in their lives.
That is an awesome definition. Thank you. So now that we've gotten a definition, let's take a look at the spirit of MI. You have a great acronym here, PACE. So in understanding motivational interviewing, we do have to know the mindset and the heart set of motivational interviewing. So in this acronym PACE, the first one is dealing with partnership. So we have to understand that motivational interviewing is done with the client, not for the client. So in typical therapy, the clients come to us, we represent the expert to help them through their problems. But here in motivational interviewing, it's saying that the client is equally an expert in their own problems, and we have to acknowledge that. In acceptance, it's about what the client brings to the table, and we want to make sure that we're imprising their inherent worth and potentiality. And also we want to be, to show empathy towards the client and the ability to see the problem through their eyes and honoring their own autonomy and affirming them where they are. And also compassion. We want to actively promote the client's welfare. So the goals that we develop, they're not our goals and what we think should happen in treatment, but they're the goals that the client has identified for themselves that they want to work in treatment. And also evocation. So that's where we know that all what the client needs is within them. And so our job is to really call those things out, and so that we can use the things that the client already brings to the table to help them through developing their goals. Now that we have understood the spirit and the mindset of MI, let's look at some of the core skill of MI. The core skill goes by this acronym OARS, and it's talking about open-ended questions. So open-ended questions, it's just a way that in the interviewing process with the client that you're gathering information. It facilitates dialogue. It starts with words like, please tell me more about this. Describe this versus, did you drink? Did you do this? Did you do that? Instead of yes or no questions, but it's more descriptive questionings that you're going to ask a question to get a better understanding of what's going on. Affirming. So affirm is really asking you to be sincere and supporting and promoting the client's self-efficacy, and also using their past experiences to help them recognize that they do have what it takes within them to overcome their difficulties. Reflective listening. So this shows more interest in, so that you're showing the client that you are interested in what they're saying, and that you have a desire to really understand what they're talking about and how they see what's happening with them. And also summarizing. So this is where you get to reinforce what the client has said to you, paraphrasing, showing that you're listening and that you're preparing the client to be able to move forward. So now that we have gone over the spirit and the heart of the mind, and we have looked at the core skill, now let's look at some of the stages of change. So clients come in different, that comes into therapy, there are different places, different stage of change. And there are 5 stages of change. And you have the pre-contemplation stage, where the client really don't see a problem with what's going on with them. The risks, the benefits to whatever the behavior is outweighs the cost for them at this moment. Then you have the contemplation stage, and that's where the client is struggling through their ambivalence. They can see reasons for change, and they can also see reasons for remaining where they are. And so they're going kind of doing this back and forth. And then you have the preparation stage here. Another thing about the contemplation stage, at this point, the client is already experiencing some issues, consequences rather, that may be personal, psychological, physical, legal, or they're getting arrested because perhaps of their drinking or gambling or other behavior that is causing some issues in their life that they can actually really see that this is now a problem. Now in your preparation change, and that's where clients, they're less ambivalent. They're really seeing that there is a problem and I really do need to do something about it. And they have already started making steps toward change. And they realize that change is a very necessary thing for them. Your action stage is where the clients, they're serious about changing. They know that they have a problem. They recognize the risks and the cost to them, and they're willing and they're ready to do work. And here, the one thing that we want to be mindful in this stage is for relapse. So while the client is doing really well and is trying really hard, there is always a chance of relapse, especially with clients that have substance abuse issues, because it is difficult to kick the habit. And so relapse is something that is very big here. And their last stage is the maintenance stage, where the clients, they're successfully implementing skills that you have taught them and that they're working really hard and they're doing very well on this stage. So understanding these stages helps us to, when you know where your client is, it helps you even in your questioning and in your treatment planning, how to best help them move forward. So we have gone so far on the spirit of motivational interviewing. We've learned the core skill, and we've gone over and we've identified where our clients are in the stage of change. Now, in discussing change talk, so this is where you're listening to clients and you're trying to pick up what are they saying that is moving them towards change. So there's a great acronym, DARN. And so the first one is desire. You're listening for why would the client want to make the change. So the client may say things like, I really desire to make changes, or I wish I could do this. So those are the languages you want to listen out for, to see where the client is also in this stage. Ability. So the client's belief about their ability to make change. So listening for how do they plan on doing this. Reason. What are the client's reasons for wanting or not wanting to make the change. And so even in this stage, it may not, well, you know what, I enjoy gambling. I enjoy the high of it. So there are benefits to them as to why they don't want to make the change at this moment. So you want to listen to those keywords of things that the clients will tell you that will tell them where they are in this stage. And the last one is need. So what is the urgency? Why right now? And that's very important for you to know why the client wants to change right now because when they're able to tell you that, it helps you to understand where along the continuum of change that they are in. So we have gone over the spirit and the mindset of motivational interviewing. We've talked about the core skills, and we've talked about the stages, and have identified the stages of change for clients. And now we've talked about how to hear out for change talk. So now let's go into putting all that together in the processes of motivational interviewing. So there are 4 processes of motivational interview: engaging, focusing, evoking, and planning. And if you look at these, they're quite similar to the stages, the spirit of motivational interviewing. And they sort of mirror each other in some sense. Here with engaging, this is about establishing a connection, a working relationship with the client. In focusing, you're looking more into the importance of building the therapeutic relationship, and identifying the reasons the client actually came in for treatment and the type of goals and that they're looking to accomplish through treatment. And you're looking in here in evoking, you are really eliciting the client's own motivation for change. Why is change so important? So listening to hear helps you encourage and motivate the client towards change. And planning, and this is where you are moving more into the change talk, and creating specific goals and treatment plans for the client, with the client rather, not for the client, because MI is for the client, with the client, not for the client, sorry. And so, in thinking about how you would implement this, I want you to think about this question as we've been talking about motivational interviewing, and we're going to look at another video, and we're going to have in a few minutes an opportunity to do some role play. I want you to think about this question: how would you implement this in your own practice? Okay, so now let's see what real motivational interviewing looks like.
Hi, Ms. Clark. My name is Alan Lime. I'm a social worker at Family Health Center. Dr. Seal asked me if I would spend some time with you today. I'm really glad that you're here. I'm just curious as to why he was in.
Well, I came to see Dr. Seal last week because of increasing stress and anxiety that's kind of getting the best of me. And in the course of my appointment with him, he was asking how I was dealing with that stress. And I mentioned that my 1 or 2 glasses of wine a few nights a week is turning into more frequent, and maybe 3 or 4 on some nights. And he had some concerns about that, and felt like maybe you could help me with stress or something.
Yeah. So he asked you to see me because you went to him for increased stress, and he's concerned that your alcohol consumption may be part of that increase. Prior to prescribing you anything, you want to make sure that he's had some influence with that.
I suppose.
I saw you filled in one of the picture sheets. Can I take a look at that?
He told me to fill it out and bring it with me.
Okay, thank you. You say here that you have 4 or more drinks in 1 week. You mentioned that you may be increasing that a little bit as well. And that you have 1 or 2 drinks a month. So,
Typically.
yeah, and maybe monthly you have more than that. What kind of drinks do you have? What do you drink? What do you typically drink?
Wine with my meals. Again, 1 or 2 typically, and more frequently 3 or 4 since my stress has increased.
So it's starting to increase, you're starting to drink more. Well, based on what you put here, it gives you 6 points on this scale. Scale ranges from 0 to 40. So 6 points will put you in what we consider an at-risk zone. So if it's okay with you, let's just talk a little bit about that.
Okay.
So the at-risk zone, say, runs 0 to 40. It's not a super high risk, but it certainly could be a risk for maybe increasing stress, maybe some physical elements related to alcohol as well. Could start to show up if you were to increase your drinking from there, or even stay there. This is a typical standard drink size over here. I'm not sure whether that fits your description of a glass of wine or not.
I filled the glass up, so maybe a little more than
Yeah,
that.
maybe that little space at the top. So if I had to drink and a half each one, so So that also increased a little bit more. So perhaps maybe drinking more than you indicated over here. And for a woman, healthy woman your age, no more than 3 drinks in one setting is considered to be lower risk, and no more than 7 in 1 week.
7 total in 1
Total
week?
in 1 week. And what you say here is that even on this sheet, you're perhaps only drinking more than that. So what do you make of all that?
That's news to me. I thought red wine with your meals is supposed to be healthy, and no more than 7 in a week. That seems kind of prohibitive.
Yeah, it seems a little less than perhaps you've been drinking or what you consider to be healthy. And certainly there's this conflicting information out there about what's healthy and what's not healthy. I imagine the increased stress is what concerned Dr. Seal. And the stress increases, and if he were to prescribe you anything, there may be some interaction between the two. Of course, there is something I would think. So if you would, what is it that you like about alcohol?
Well, it does, at least in the moment, temporarily reduce my stress. And I, like a good glass of wine. I don't drink the cheap stuff. I like the expensive.
You like the taste of it? It does help to lower the stress, even if it's just for that amount of drinking. What are the other good things about alcohol?
Well, the nights that maybe I have a couple more glasses than I should, I wake up feeling kind of yuck. And, of course, part of my stress is finances, and I mentioned I like the good stuff, and so if I'm drinking more, then I'm increasing my financial burden.
So your financial stress may be increased by the fact that you're drinking.
Yeah, kind of defeating the purpose there.
Catch 22, that drinking reduces stress and increasing stress at the same time.
So for the interest of time, we're going to pause this video, stop this video rather. I'll give you guys the reference so that you can look at it afterwards to finish the whole video. But I wanted you guys to get a little glimpse of how motivational interviewing is done correctly. Let me see if it's removed off the screen. Because I want to give you guys some time to do some practice yourself. Okay? So from the video, you can certainly see there's a difference in the approach of the therapist in the first video, how some of you guys mentioned he was very offensive and made the client feel uncomfortable. This second video that we watched, the client was very comfortable and was engaged, and he was able to engage in a lot of the skills that we learned, we just learned with MI. You saw the therapist implement some of these. Well, I want to give you guys an opportunity to have some fun as well and to implement some of these skills yourself. So we're going to be doing a role play. So let me give you some instructions about the role play. Here's a package for each one of you guys. There you go. I'm glad I'm seeing some of you guys take notes, which is awesome because that's going to be very helpful to you all. So you have 2 case studies, okay? So Fabiola and Jennifer, you guys can partner together because you're sitting closer to one another. And Shirley and Joanne, you guys can partner together. So there's 2 case scenarios, one with Marcy, and the other one says Mark, but it's actually Martha. It's a woman. So when you read it, please keep that in mind. Also, in this handout, you have the Motivational Interview and Prayer by Dr. Miller, and we should just read it together, as a matter of fact. So you guys have that in front of you? So let's read it together since we're going to practice. So on the count of 3, 1, 2, 3.
Guide me to be a patient companion, to listen with a heart as open as the sky. Grant me vision to see through her eyes, and eager ears to hear her story. Create a safe and open mesa on which we may walk together,
Making me a clear pool in which she may reflect.
Guide me to find in her beauty and wisdom, knowing your desire for her to be in harmony, healthy, loving, strong. Let me honor and respect her choosing of her own path, and bless her walk freely. May I know
that although she and I are different, yet there is a peaceful So you see, this prayer is really shows you the role of a therapist. The role of a therapist is to be this compassionate individual that's walking with the client through the process of change. Not to be leading and guiding and say, here's the way, how you should go, but it's walking with the client, patiently walking with the client. Also here in this package, you have the ORs and motivational interviewing principles, kind of like a little cheat sheet. So as you guys are doing your role play, you can make sure that you guys are staying in line with that. Okay? And then your final page is the motivational interviewing self-evaluation checklist. Just to make sure that you are also using some of those tips effectively in engaging your client. Okay? So you guys have your case studies. So the first one, Fabiola, you'll be the therapist in the first scenario, and after you're the therapist, Jennifer will be the second therapist in the second scenario, and you guys will do that. So we'll start with you, Shirley, as a therapist, and Joanne will be the client, and you guys can reverse. What I'll do is just go around as you guys are in your role playing, just to make sure you guys are implementing the steps correctly. Okay? On your march, get set, go!
So Marcy, tell me, how did you feel?
So it seems here that you were arrested a couple months ago for driving with a high blood.
So how do you feel when you're drinking? What are some of the emotions that you
Pretty intense.
Could you describe the experience a little bit more?
A little scared.
So this happened 5 months ago,
Right.
was there anything
It
that
seems
kind
like
of
you also
influenced you?
lost your job.
Are you out with friends? Were
It
you
was a social stuff. I know that.
Are you really dependent on
You
your
on
phone?
one
How
on
is
one?
that been working?
drove your car there?
Pretty hard.
So what made you pick yourself to drive home, especially if you were drinking and consuming? What's okay?
I didn't feel wobbly or anything, so it's not like I was falling out of the shit.
Well, this is a situation.
And then
Looks
it
like
also
it
says
was,
here that you, Steven, how's things with Steven?
Your boyfriend, girl? How did you guys?
Been on and off since this happened, he's got tricky to form back.
He's been a mess. He's been
I can see.
pressuring me to get a job,
How does that
to
make you
work,
feel?
and bills, putting on me.
Why are you angry? Because he doesn't want to drag you around?
And you described to be a lawyer.
I did, but right now
So are you telling me you drinking?
Your mother is also a lawyer.
No.
Wow,
But
she
she
is.
is.
Neither's not gonna be okay. I feel pressure.
Someone else is supposed to feel. And you're putting them in a situation. And they're going to benefit that. And now he has to wait on you and make sure he gets you at this time and get you here and stuff. How do you think he
You can
feels?
say that's been a part of it.
Switch
I
roles.
feel like doing that is like an escape.
It's about choice.
Sometimes it's therapeutic.
So
It's when
if
you
it was
remind
the other way
of these
around,
things, of what's
it's
going
just
on.
about choice, but if it was
And it's
the
not like
other
I'm
way around,
drinking
it's
heavily.
Really? So you pick him up anywhere he wants to go? Buy him a ball, bear down and give him all the alcohol because that's what he's doing for you. There's world to
Times
switch.
what's that called? The GMAT security grants for lawyers.
So we'll stop here with the first case scenario. I want to tell you guys, I'm really proud of you guys because I really, as I'm going around and hearing you, I definitely hear you guys using the oars, and you're doing a really great job. So I'm super excited. So we'll switch. The therapist for the previous one will now be the client, and so go ahead for the second scenario.
So Martha, how you doing today?
So, seems like I've been racking
2 children with you?
Yeah, I have a 3-year-old and a
It just feels
5-year-old.
really, really good because I think it would be good.
My husband and the kids, they sleep pretty early, so that gives me a good opportunity to handle night life quite well.
What? Very good. That's a really great point.
Great. So where do you go?
It's just keeping me on my family and being able to pay for mortgages and stuff. What is your challenge?
I guess like if my kid was up in the middle of the night and I'm not there, and that has happened on
Yeah, I
several
completely
occasions.
understand. What has your husband said before I can?
He often questions where I am.
Can you tell the truth? Are you honest with him?
So I told him that I've been taking midnight strolls just to clear my mind. So I guess I haven't been fruitful. But I know he's starting to see it.
Very good point.
He's starting to see it in his
No,
life.
it's kind of like a thing for you to de-stress. You need to focus on the ball or
It's a fresh lesson. I know the big statements
other
will
things that
say.
you want to think about. So it sounds like yes,
How do you
very
think
good
we
point.
can address the issues with your family? What
Yes.
steps do you think you can take forward to look into helping you stop and maybe find another outlet to release the stress or that or getting you that high that you feel? Because you are a painter, you're a musician. Is that not fulfilling anymore?
No, if I can get rich quick, runs away.
So we're gonna bring this one to a
That
close.
was a good question, right?
You guys are just incredible. So I am so proud of you guys as I went around just really listening to you guys talk and listen to you guys use the OR skills. You guys are ready. You guys ready to go out there and really help clients. So I'm very, very proud of you guys. You know, practice makes perfect, and so I encourage you guys to continue to practice and practice. As you get out into the clients, with the clients, it's okay. You guys are ready, you're prepared, you know, and I'm proud of you guys, so you guys will do an excellent job as you guys begin to show your compassion and your sincerity for clients. So, as we wrap up, let's look at go back again on the learning outcomes, okay? So on the outset, on the outset, we talked about 3 learning outcomes. And so I just want to review those outcomes again and just kind of get, just from you guys, how has that been helpful to you? So in analyze, we're going to analyze understanding of the process and spirit of MI through role-playing and peer evaluation. Can anyone share how the role-playing was helpful to them? Fabiola?
I thought it was really engaging and it helped on creating that therapeutic alliance with the therapist and the client. It definitely elicited the client's own motivation for change, as well as moving her towards the planning and treatment stage.
That is awesome. Thank you very much for sharing that, Fabiola. In terms of evaluate, so evaluate how the use or lack of proper use of the spirit of motivational interviewing affects the outcome of motivational interviewing as an effective treatment modality for clients struggling through ambivalence to change. Now, please someone share with me, how were you able to evaluate this? Oh, Shirley?
Well, from the bad video, I hated how the therapist treated the client. He stripped her of her rights as a human to be respected and valued.
Mm-hmm.
Her problem didn't change, and the fact that she was created in the image of God and deserving of inherent worth was still there. His behavior made her decline treatment, like she really needed it. So I didn't come into this work to push people away who may need my help. So I didn't appreciate that video. But in the second video, the therapist implemented the spirit of MI by establishing a partnership with the client. He was acceptant and compassionate compassionate towards her and help evoke change out of her. That's the kind of therapist I want to be.
Well, that's the kind of therapist we hope all of you guys are. Absolutely. Incorporate OR's skill of motivational interviewing as a foundation in developing your own counseling style. Anyone would like to share how they found the ORs helpful in developing their own style? Jennifer?
So in incorporating, I thought implementing the ORs, the open-ended questions, I was able to kind of facilitate a dialogue and obtain better understanding of her needs through the examples, and also to affirm I was sincere and utilized her past successes to kind of encourage her future successes. The reflective listening, I was able to repeat, rephrase, and really reflect what she was feeling back to her. And then to summarize, to help her move forward. I summarized to show her that I was listening, and she was even able to show that she felt like she was being heard. I mean, as an upcoming therapist, no matter what the other modalities are that I'll use, ORs will always be at the core of how I engage my clients.
Okay. That is so awesome. I thank you guys so much. From your responses, it really shows that you guys really have a great understanding and grasp of motivational interviewing. And our heart here is really, as we go out into the community and we're sitting with clients and they're bringing their difficulties and their problems before us, we want to make sure that we don't think of ourselves as the expert, the one that's coming to fix the client's problems, but that we are there to partner with the client because the client is an expert in their own lives, and we want to make sure that we recognize that they bring value and worth to the therapeutic alliance in that relationship. And so we need to be able to hear out from them what they're saying, see where they are in the stages of change, and work with them through their change shock and through their ambivalence so that we can move them towards developing goals, because we want the clients to be at the maintenance stage in the stages of change, but there's work that has to be done, and being able to hear the clients where they are and walking with them through the process is going to help them to be successful, help you to be successful in helping the client be successful, and so that they're able to implement tools that they'll be able to use in their life if the issue ever arises. So our goal is to teach clients skills that they can use for the rest of their lives as needed. And so I am really blessed and honored to be able to come before you guys today, share more about motivational interviewing, and really help you guys begin to establish that as your way of engaging client, so that when you go out into the field and working with clients, you can be proud of the work that you're doing.